The shortage of protective equipment for health and social care staff has been a key issue as coronavirus has spread. The government says there were some initial distribution problems, but insists it is now delivering millions of items a day. But hospitals, care homes and GPs are still contacting factories directly, asking for fresh supplies. Here's our business reporter, Simon Browning.
Off the truck and straight to the factory floor. The demand for PPE is urgent, and UK factories who've been besieged by requests for help are getting to work.
We can stop any production that we're doing at the moment. ASOS have really encouraged us to stop their production in favour of the NHS.
Jenny got a call from an NHS supplier who can't get its normal stock from overseas. Her first order is for 5,000 sets of scrubs by Monday. The race is on.
I think it could have happened a couple of weeks earlier, if I'm honest. We're looking at least 20,000 a week. We've also got other ladies as well that didn't have enough work, so they're going to come back too. So we're really going to go for it.
Within 30 minutes, the first bottoms have been cut and overlocked.
Well done, Christina. This is why you have to make in the UK.
Factories like this received a survey from the government a fortnight ago, asking them if they could make PPE. 2 weeks later, and the majority still haven't received a response. Now manufacturers are taking orders from third-party suppliers who'd usually get the PPE made overseas. Because the supply becomes restricted and the world fights the virus, UK factories are desperate to help. Chapman Bags in Cumbria is silent. The factory empty, machines idle. The boss told the government he could make PPE a fortnight ago.
We have 25 staff. At the moment, they're all at home, not doing anything, and they're desperate to help.
Here in Chesterfield, Specialised Canvas was looking at closure. Its order book crushed. People don't want teepees, so now they're making face shields.
We were getting contacted by people who had problems with supply outside of the critical care infrastructure, so people like nurses doing home visits, care homes. We're now making isolation gowns, and we've also developed a pacifizer product very rapidly as well. We started off shipping 200 units on Monday, we shipped 400 yesterday, and we're hoping for more than that today.
The trade body representing the textile industry says finding a solution hasn't been easy.
There has been delays, but we're working with the UK government now, with the UK textile industry, and bringing everyone together to make it happen as quickly as we possibly can.
The government admits there were limited distribution problems to begin with, but says it's shipping millions of units a day. But with care workers, GPs and hospital managers calling factories desperate for help, it seems there's still a very long way to go. Simon Browning, BBC News.
Well, it's never been more important to